My name is Christopher Woods, and I am a UNLV School of Nursing graduate student in the Nurse Educator program. And this is my continuous quality improvement video presentation on the effects of dietary intake and spending by reducing restaurant prepared meal consumption. This project was completed as a requirement for NURS 711 Nursing Informatics and Quality Improvement course with Dr. Serafika. The objectives of this assignment were to identify and describe my specific aim, highlight the PDSA cycle activities that were completed as part of this project, identify the project's outcomes, and post a post-project reflection. What is a Continuous Quality Improvement CQI project and the Plan, Do, Study, Act PDSA method? The National Learning Consortium describes continuous quality improvement as the process of examining how it is going and areas that could be improved to enhance the quality of healthcare delivery. The Plan, Do, Study, Act model is a common method used with CQI to identify a problem, set goals, and establish guidelines through a sequential process that allows for measurement of improvement, with the cycle being repeated until the desired outcomes are met. Next, I will discuss highlights of my PDSA activities. The planning phase began with identifying a problem and establishing a specific and measurable goal. My goal was to improve my dietary intake and reduce spending by decreasing the amount of restaurant-consumed meals. The week prior to planning, my fiance and I consumed a total of 4 home-prepared meals, 2 each. Both of us also have experienced weight gain over the past year, and I realized that restaurant-prepared meals were a large monthly expense. Furthermore, both my fiance and I were often skipping meals when we were too busy at work. Busy work schedules and working full-time while in school were identified as contributing factors. Worksheet A provided in the course module was used as a template during this phase. A fishbone diagram and a process map were also created as a roadmap for success and identifying influencing factors. The team was selected and included myself, Scott, my fiance, as participants, and Lindsay, who is a friend and co-worker, to act as a support system during the project. I chose this goal because it's important for me to address my dietary intake, as nutrition plays a vital role in disease prevention and health promotion. In addition, I have an upcoming wedding planned for February 2021, and the funds saved through eating at home could be allocated for the ceremony and reception. Next, an evidence-based literature search was completed. The CDC's Healthy People 2020 website identified leading health indicators, stating that nutrition and weight status are important national health objectives, and their goals include weight reduction, healthful diet, health promotion, and reduction in chronic disease, and that poor dietary intake can lead to obesity, hypertension, malnutrition, anemia, dyslipidemia, type 2 diabetes, and oral disease. Also, that dietary intake is influenced by where people eat. It's important that interventions and policies are in place, allowing for healthier meal options. Restaurant-prepared meals often have less nutritional value and are higher in calories and saturated fats when compared to home-prepared meals. A 2014 descriptive cross-sectional study of 147 first-year medical students by Shaw et al. Revealed that there was a significant relationship between body mass index, BMI, the consumption of fast food and soft drinks, and low levels of physical activity. A self-structured questionnaire was utilized to determine possible correlations. 138 out of the 147 students ate fast food, and the questionnaire determined that 34.05% of the medical students' BMI classified them as pre-obese or obese. I found this interesting, that 20% of the students did not have daily fruit or vegetable dietary intake, and I can relate to this as a nursing student. It can be challenging to make time to prepare healthy meals and increase physical activity while in school and working full-time. During this phase, my fiance and I agreed that each cycle would begin on Sunday, and the weekly menu for home-prepared meals would be selected and purchased on the Saturday before each cycle starts. We set a goal of at least 5 evening home-prepared meals during the cycle, a total of 10. We also established that weekly weights would be measured each Sunday morning and that a meal journal would be used to record menu items, as well as the type of meal, either categorized as home-prepared, restaurant-prepared, skipped meal, or other, which was defined as either being prepared by a friend, family member, or provided by our employers. Expenses on dining out and grocery expenses were recorded Saturday evenings for evaluation. The process included a 3 PDSA cycle with weekly data capture and implementation of change ideas during cycles 2 and 3. We began the first PDSA cycle on March 14th. We selected 5 evening home-prepared meal choices, and they were purchased. We also recorded pre-intervention weights. We also captured type of meal, whether home-prepared, restaurant, skipped, or other, and recorded menu items for each meal in a meal journal. During the study phase, we discovered the first cycle went really pretty well. We exceeded our goal of each participant eating at least 5 home-prepared evening meals. My fiance was able to go to the store after work one night and purchase dinner for another home-prepared meal. So we ate 6 evening prepared meals, which was a total of 12 for us, between the two of us. 19 home-prepared meals were consumed between the two of us, and that's for the entire week, and both participants experienced weight loss. However, our skipped meals remained higher than I had expected. During the ACT phase, we identified obstacles. We realized that busy workdays were still impeding consumption of a full lunch meal, and we were experiencing a few challenges in recording data post-meal. So we began to implement change ideas to address this situation. I purchased small notepads to make it easier for both of us to record our meals right after eating them while we were away from home. And we also included healthy snacks like yogurt, nuts, fresh fruit in our lunch work bags. And additional portions were purchased and prepared with evening meals to be consumed as leftovers. As for the project's outcomes, overall the process was really easy to follow. We did have a significant increase in home-prepared meals. We ate 59 home-prepared meals over the 3-week period between the two of us. We also lost a combined total of 17 pounds. Skip meals did decrease during cycle 2 by 54%. However, they did remain higher than expected and were higher than the first week during cycle 3. And there also was an increase in food-related expenses at the grocery store. And the goal of at least 5 home-prepared evening meals was not met consistently across all 3 weeks. However, we did remain within the upper and lower control limits. So I think we did, overall, I was pretty pleased with the results. This slide contains visual references of our weight loss and combined meal type percentages for all 3 cycles. During the 3-week period, 48% of our meals were home prepared. While there's still room for improvement, this is a dramatic difference when compared to the week prior to planning. We also, again, lost 17 pounds total. I lost 6.5 and Scott lost 10.5 pounds. However, skip meals were still high and could be a limitation for the study related to weight loss. Reflecting on this project, I feel that I've got a greater awareness now of what CQI is and how to develop, implement, and evaluate a PDSA cycle. Overall, I was very pleased with the results, and I found the assignment enjoyable. Some possible changes for greater financial savings in a future PDSA cycle could include purchasing protein items on days when on sale, and then freezing additional portions for later, as well as meal prepping prior during the week on one day to prevent ordering or picking up fast food when unmotivated to cook. I look forward to using this method in both my personal and professional projects in the future. I think it's a great way to improve quality. Thank you for your time.